You really need to know these most common prediabetes symptoms. Do you know approximately 88 million American adults have prediabetes? And the worst thing is most of them do not even know they have it. The issue is you may not notice the prediabetes symptoms, but still it will do its work of destroying your body. And in a few years, you will get type 2 diabetes, heart attack, or stroke. You could be one of 88 million people. Scary, right? What you could do is learn about prediabetes symptoms and stop them before it's too late. So, are you ready to learn? In today's video, we will share with you the 13 most common prediabetes symptoms you should know to take care of your health. Number 1, a high blood glucose level. It is essential to know your numbers, especially if you're overweight, have a family history of diabetes, or have other risk factors. According to the Centers for Disease Control and Prevention, fasting blood glucose levels should be 99 milligrams per deciliter or lower. Numbers between 100 to 125 milligrams per deciliter indicate prediabetes, and 126 milligrams per deciliter or higher is a sign of diabetes. You can check your blood sugar levels by doing an A1C test, glucose tolerance test, or fasting blood sugar test. Number 2, unexplained tiredness. Tired and sleepy all the time, even after taking a nap? It could be a sign that your blood sugar levels are higher than regular. With high sugar levels, the body fails to provide cells with enough glucose to meet their needs, which results in weakness and fatigue. Generally, we all need a good 6 to 8 hours of sleep. If you are still feeling tired after that, there could be a problem. Though it could be due to lack of decent night's sleep, stress, or hard work, it is always best to consult your physician. Do you find this video interesting so far? Please don't forget to subscribe to my channel, hit the like button, and ring the notification bell if you want to see more content like this. Number 3, slow healing of wounds. If you have a wound or cut and feel like it is taking a long time to heal, this could be a sign that your sugar levels are too high. High blood glucose limits the supply of nutrients and oxygen to the cells, increases inflammation, affects immune function, and makes wound healing a complicated process. Skin injuries and cuts may take up to 3 weeks to heal in pre-diabetic people. In some cases, wounds can even become infected. If you notice continuous drainage, odor, or discoloration, this may be a sign of infection. Number 4, excessive hunger. Constantly feeling hungry is one of the most common prediabetes symptoms. When the body is not producing enough insulin or is not responding to it in the usual way, cells become deprived of glucose, and that causes increased hunger that does not go away even after eating. Eating only makes blood sugar levels higher, which makes the situation even worse. In medical terms, this condition is called polyphagia. If you keep eating, but your hunger persists, you should consult your physician. Number 5, aching joints. A report from the Centers for Disease Control and Prevention found that 32% of adults with prediabetes also have arthritis, and most of them are inactive or overweight. Engaging in regular exercise, losing extra weight, and dietary changes can help in lowering joint pain and reduce the risk of developing type 2 diabetes. No doubt, with joint pain, it is difficult to do exercise regularly. Try doing activities like stretching, walking, or swimming. Number 6, kidney damage. A study published in the journal Diabetic Medicine confirms that not only full-blown diabetes, but also prediabetes can affect your kidney's health. It harms the kidney by damaging tiny blood vessels inside the kidney. High blood sugar level causes clogging and narrowing of these vessels, which disturbs the kidney filtration process. If blood sugar level remains high for a prolonged period, kidney disease can aggravate and even cause kidney failure. A urine test can help to find out about kidney damage and diabetic kidney disease. Number 7, skin conditions. If you are constantly getting itchy skin or fungal or yeast infections, this can be a sign that your sugar levels are too high and are causing these infections to occur. These types of conditions commonly occur in areas where skin folds and is warm and moist. So if it is happening a lot and you have not talked about it to your healthcare professional and are treating it at home, it's time to make an appointment and get your sugar level tested. Number 8, blurred vision. Blurred vision is one of the common prediabetes symptoms. It happens due to the shifting of fluids, which makes the lens of your eye swell and change shape. It affects the ability to focus. These changes are reversible, and your vision goes back to normal when your blood sugar level gets stabilized by treatment. But if left untreated, high sugar levels can cause heavy damage to the eye, including permanent loss of vision. That's a huge price to pay for ignoring the health problem. Number 9. Digestion issues. Frequent digestion issues like bloating, diarrhea, constipation can indicate more than just gastrointestinal problems. According to a study published in the journal Diabetes and Metabolic Syndrome, people with prediabetes suffer more from gastrointestinal symptoms than healthy individuals. High blood sugar level damages the vagus nerve, which results in slow digestion. Food stays in your body longer than it should be and causes issues. If digestion issues continue and remain unexplained by other conditions, one should go for a pre-diabetic assessment. Number 10. Frequent urination and excessive thirst. If you have to get up every couple of hours to urinate, this could be an early sign of diabetes. When you have a high blood sugar level, your kidneys try their best to filter all the excess sugar out. This filtering process causes more urine production. In medical terms, this condition is called polyuria. An adult's daily urine output is usually 1 to 2 liters. More than 3 liters a day could be a sign of prediabetes. When the body is excreting more than usual water, it can lead to dehydration and a continuous thirst. Number 11. Inexplicable mood swings. Many people suffer from depression, anxiety, mood swings without even realizing this could be a symptom of diabetes. A study published in the Journal of Medicine and Life shows the prevalence of depression is more in pre-diabetic people than in individuals with normal glucose metabolism. Fluctuating blood sugar levels influence the emotional response in the brain, which results in a feeling of anger, sadness, and anxiety. So if depression and frequent mood swings are part of your life, it's better to get screened for diabetes. Number 12. Numbness and tingling of hands and feet. High sugar levels can damage the nerve cells and block the transmission between them, which results in numbness and tingling sensation. If you are suffering from anything like that, you need to speak to your healthcare professional. A study by Johns Hopkins neurologists shows the damaging effect of prediabetes on motor nerves. The patients with prediabetes lost a significant percentage of nerve fiber density during the study. According to researchers, pain and numbness of hands and feet could be canary in the coal mine. Number 13. Sudden weight loss or muscle mass loss. When there is not enough insulin or is not responding in the usual way, glucose fails to enter the cells. As a result, body cells become deprived of glucose and start burning muscles and fats for energy. Burning of muscles and fats causes sudden unintentional weight loss and muscle loss. Polyuria and dehydration also cause weight loss. Increasing protein intake, eating smaller, frequent meals, and keeping track of calorie intake can help to control weight and muscle loss. The good thing is, prediabetes is not a permanent condition. You can reverse it with proper care. If you are suffering from any of the symptoms mentioned above, go and get yourself screened for diabetes before it is too late. If you are diagnosed with prediabetes, think of losing weight, making lifestyle changes, and eating healthy. They can be the key factors to turn your path towards a healthy life. Did you find this video helpful or informative? Let us know in the comments section below. Make sure to subscribe so you don't miss out on my future videos. Don't forget to like and share. Stay healthy!